Well, hello, everyone. Welcome to Samaritan's Purse International Health Forum. As always, we're just delighted to have you with us today. You know, we're all going through so much with the pandemic, but actually here at Samaritan's Purse, we're doing quite well despite just all the adversity around us. As Christ followers, it's so great to have that assurance of salvation and just to have Christ with us. So today, we just want to reach out to you, our audience. And really, regardless of how you participate with us here at Samaritan's Purse, whether you volunteer with us here at World Medical Mission, or perhaps with you're involved with our surgical subspecialty teams or our disaster assistance response team, we just really want to express our appreciation to you for your service to us and, of course, to the Lord. And we're just delighted to have you with us. Thanks for being with us today. As always, to get things started, just a few of the logistics. If you'll look to your chat box to the right of your screen, just encourage you to use that. If you could just type in your name, where you're listening from, so we have a good idea of who our listening audience is today. And we'll also use that chat box at the end for Q&A. But before we get started, I want to open up in a word of prayer. So please bow your heads with me. Dear Heavenly Father, we just thank you for this day. We're just delighted to have Dr. Widman speak to us today. And Lord, just thank you for our audience and our volunteers who contribute so much. We could not do it without them, the hands and feet of Christ. So just speak to us today, move us in ways that you want us to serve, fulfilling the Great Commission. In Christ's name we pray, amen. So today we're just really excited to have Dr. Bernhard Widman join us with his presentation, Global Surgery, Why I Want to Be a Part of It. Dr. Widman, he was born in Austria, where he completed his medical studies in 2010. He's currently working as a consultant for general surgery at Coma Hospital of St. Gallen in Switzerland. Really, it's an amazing story. The experiences and contacts that he made during a 4-week short-term mission trip with World Medical Mission to Kajabi Hospital in Kenya in 2020 were really crucial to his decision to further invest in global surgery. God just really spoke to he and his family while they were there. In 2022, now he and his wife, Lydia, who actually serves as an intensive care nurse, they will be moving to Coma Hospital in Malawi, where he will be a part of part of the surgical faculty at this new Pax location. If you're not familiar, Pax is Pan-African Academy of Christian Surgery, or surgeons. Dr. Widman's wife, Lydia, she will be starting up the intensive care unit there by training Malawian nurses to serve in the ICU. Really, for both of them, this is a shared childhood dream that is actually coming to fruition, becoming a real reality. So, Dr. Widman, we're just delighted to have you with us today. I was just in Malawi in September with our surgical subspecialty team, an orthopedic campaign. What an amazing hospital in Coma Hospital. Just delighted for you and your wife, Lydia, to be serving there. So we're just delighted to have you speak to us today. So without further ado, I'll turn it over to you.
Thank you very much, Lance. Yeah, we tried several times to go to Coma, but the pandemic made it more and more difficult. And with 3 little children, we haven't been there yet, but we hope to be there in April next year. My talk today, Global Surgery, Why I Want to Be Part of It, will be quite a lot of personal experiences. And I hope it encourages you that if a regular guy like me with a regular family can do something like that, you might join in and invest into global surgery as well. Next slide, please. One slide back. One slide back, please. Not the other direction. One slide back. Yeah, that's perfect. To give you a short overview, I'll introduce my family and me a little bit. It will be quite a few personal experiences. It will be a personal talk. Don't mind to ask personal questions at the end. I'll introduce us in a minute. Then I want to give a short overview about some information about global surgery. It really struck me to read those things, and It moves me that so many people in the world don't have access to surgery. And then I'll share a little bit about our short-term missions trip as a family that really changed a lot in our lives, and move on to why we want to invest in the long-term, in long-term medical missions. Next slide, please. This is our family. I want to start with the picture of our family because I think family is really crucial. It's crucial if we work in our home countries. They support us in our successes. They stand behind us in our failures. But especially when we move abroad, I think it's a huge chance for the family to get together, to come close together. It improves our resilience. There is so much the family can give, and it's such a great opportunity, no matter if in short-term or long-term missions, where we can spend time together. Next picture. So this is us. My wife Lydia is an intensive care nurse. She was also training intensive care nurses in Switzerland. I'm a general surgeon. We have 3 kids, Finn, aged 3, almost 4, Nathan 2, and our Lena is 5 months old now. Next slide, please. Lydia is actually an American. She grew up in Jordan, where she finished high school as well. We did our training in Jordan, in Austria, in Switzerland, and also in Great Britain. What brought us together in the very, very beginning was a dream that started as individuals. When I was 14, I didn't know Lydia well at that time. I wanted to become a doctor in a country without doctors. And Lydia had a similar dream. When we got to know each other, these 2 dreams became one dream, and it became a passion ever since. So this question, if we should ever move abroad to practice medicine in the name of Christ in the country with low resources, has been on our mind for quite a while. Next slide, please. I want to talk a little bit about global surgery. And I'm a surgeon for 11 years now, working as a doctor, and I haven't known much of those things before. I think even the global health community did underestimate the huge surgical need in low-resource countries. Focus in these countries was often malaria, HIV, tuberculosis, and surgery was left out a little bit. The next slide will show that the Lancet Commission of Global Surgery, with a very important article in 2015, changed quite a bit. And they estimate that 5 billion people on this globe are without access to surgical care. And that's, that's hard to believe. It helps a little bit to define access to surgical care, and it means that access can be timely. A hospital with 24/7 surgical care has to be reachable within 2 hours. Essential surgery care has to be available, and with essential surgery care, they define cesarean delivery, laparotomy, and the treatment of open fractures. So it's quite a limited offer of essential surgery. It has to be safe and effective, and it has to be affordable. And the whole topic of being affordable is a huge issue in countries without insurance, where catastrophic health expenditure is very, very common. It does not surprise, with 5 billion people without access to surgical care, that the death toll and the burden of disease is very, very high. But it's surprising that it's even much higher than HIV, tuberculosis, and malaria altogether. It's estimated that 1/3 of all deaths worldwide are due to conditions needing surgical care. Next slide, please. It is estimated that there are a little bit over 300 million surgeries performed worldwide. an additional 46% or another almost 150 million additional surgeries are needed to cover the world's need. And it's not astonishing that only 6% of all surgeries occur in the poorest countries where over 1/3 of the world's population live. Surgery is quite resource intensive. It needs a lot of personnel. It needs a lot of equipment. And even if the impact is high, it's difficult to start a surgery when low resources are available. Next slide, please. It is estimated that 20 to 40 surgical providers per 100,000 population are needed to cover the surgical need of a population. Surgical providers are not only surgeons, also anesthetists and obstetricians. So we can see on this map that especially in sub-Saharan Africa, the rate of surgical providers per 100,000 is often below 1. So an increase, a 20-fold or even 40-fold increase is necessary to achieve that goal. And to achieve that, another 1.3 or 2.3 million additional surgical providers are needed, especially in those low resource regions. Next slide, please. I do like those cartograms. They're quite old, so they're not, I think they're almost 15 years or a little bit older. And the upper cartogram shows the world's population. The lower cartogram shows the physicians working in 2004. And you can see that Africa, sub-Saharan Africa, is almost not existent in this map. And it shows again the incredible need for physicians working in those countries. Next slide, please. Sub-Saharan Africa is estimated that in Sub-Saharan Africa, it's estimated 93% of the population are without access to surgical care. And even though there are some trainings available, they're way too few. And if people get trained, a high percentage moves abroad and migrates to better paying countries or countries with a better infrastructure. This health worker migration rate is up to 72%, but in most countries in sub-Saharan Africa, it's around 50%. So if you train 2 surgeons, 1 might stay, maybe even 3 in 4 will leave. So that adds to the challenge. Next slide, please. I'll move on now to our personal experiences. And first, the short-term trip last year in the middle of the pandemic to Coma Hospital. We're actually very lucky that we were able to go. I think a couple of months before, traveling was not possible, and a couple of months afterwards, it would have been very difficult as well. We were able to travel as planned from October 25th to December 4th last year. We had altogether 6 weeks, of which 4 weeks I worked at the hospital. We had usually 3 to 4 days in the theater and 1 day consultations. Then we were on call. Sometimes if surgeries were not possible to carry it out on Friday, we did them on the weekends. Altogether in those 4 weeks, I had 1 day where I wasn't in the hospital. The structures in the hospital were simple. It was quite easy to get into the whole system. Of course, with the more complicated stuff, you always needed support from the staff, from the local staff, which worked fine. It was a high focus on training. It was the first time I was able to experience the Pax, the Pan-African Academy of Christian Surgeons training program, and I was really amazed by it. So people were eager to learn. It was very, very good to work with them. There was a very, very high compassion. The consultants were always present if you needed them. And the residents, they were there an hour before we were, and they left last. It was really amazing how they worked. Nevertheless, what surprised me a little bit was the quite high psychological and mental strain. It is a completely different setting, so everything is new. And even if Kenya is quite established, the medical system in Kenya is quite established, and Kichabi Hospital has great resources, I often had the feeling we're always a step behind. People came in late, people were treated in other hospitals and had second opinions at our hospital, and very, very often we were not able to do anything for them. And there was one harsh story after the next. So that was way more intense than I expected it to be. The thing that was way easier than I expected was to work with low resources. So not having all those fancy devices in the theater that we are used in Switzerland, probably you in the States as well, it was quite easy to adapt to having less. Treating patients that are beyond medical possibilities, that was really tough. So I was very glad that I had 2 weeks off in Kenya. After that, we stayed on the compound, looked a little bit around, did some small trips, and it helped to work through the experiences. And I would recommend that everyone who does a short-term trip to have a couple of days, at least a week, to think about all the things experienced. Next slide, please. Here a little bit about the organizational stuff. I was pretty amazed how easy it was to organize everything. Samaritan Spurs was a great help. They sent you the lists with all the details you need. You send the information back, and it's all organized by the hospital. So it was quite a low effort to get everything organized. I was also thinking, should I take the family or not? I'm so glad I brought the family. We had an amazing time. It's so different from working in Switzerland, where the family is far away. You live on the campus. It was a great experience for at that time 2 kids. My wife was able to visit the hospital as well. It was really, really great that we took the family. And costs are low as well. I was surprised how easy and how affordable the whole trip was. A vacation to Kenya alone would have been much more financially higher financial costs. Next slide, please. And I want to share some of the experiences I made there, some very encouraging, some very challenging, just to get a little feeling how things work, and how it also broadens the horizon. On the left, we have a picture of a negative pressure system we used to have in Switzerland, everything prepared, everything with how to do instructions, and everything as you know it. In Kichabi, of course, those things were not available. They were too expensive and too difficult to maintain. So they found their own solution. If you move on to the next slide, we can see another patient. He had a skin graft that healed perfectly well. And we can see how the negative pressure wound therapy device was installed. Next slide, please. So first, they didn't have the suction they used the suction from the wall, which is a little bit more difficult to control if you want an exact negative pressure, but it seemed to really work fine. And we had 5 patients with skin grafts and all healed very, very nicely. The wound was just covered with sterile dressing, so no fancy equipment there as well. It was attached with a nasogastric tube, and it was all wrapped in just very, very basic plastic wrap, the stuff you have in your kitchen as well. At the end, it was closed with upside foil, and in between the wall suction, there was a suction container. So a very simple system, very cost effective, and also very good results. I really like the creativity, how evidence-based medicine meets low-resource medicine, and it works. We can move to the next picture. Next slide. That's another case that was originally started by the gynecologist, and it turned out to be a huge cyst. We all know the staging for cyst tumors, where the highest stage, the T4 stage, is more than 10 centimeters. This tumor was around 45 centimeters, which is almost 20-inch. It was difficult to get the weight. I asked the pathologist if she could give me the weight of the tumor, and she said it's more than 15 kilos. And I asked, why is it more than 15 kilos? And she said, my device to weigh the tumor only measures up to 5 kilos. I cut the tumor in half and also weighed the other two side tumors, and it was 14 kilos, but the two halves were heavier than 5 kilos, so it has to be more than 15 kilos. So quite basic again, but we got the tumor out. The patient was relieved within 7 days. She probably lost 1/3 of her body weight in tumor mass. Of course, recurrence rates are high, but she recovered quite well. Next slide, please. This is a short story about Jerome. He's a 34-year-old male patient. He was the patient that probably best summarizes the challenges in Africa. In August 2019, so a year before we were in Kenya, he underwent a rectal resection because of rectal cancer. There were no pathology reports available. We asked the hospital, it was a governmental hospital, several times for the reports, but never were able to achieve any. We knew from the patient that 2 weeks postoperative loop colostoma was placed due to a colon ileus, and that he received something that sounded like an adjuvant radiochemotherapy, which was interesting as well, because usually with a deep rectal cancer, you would do a neoadjuvant radiochemotherapy, which we also did in Kichabi Hospital. But for some reason, they decided on adjuvant radiochemotherapy in this case. Nevertheless, the patient came for a second opinion to our hospital a year later. Next slide, please. It's not displayed well. Can you go back again? Back again. And now the next slide now. Yeah, now it works. In October 2020, the patient came to Kichabi Hospital with a local recurrence. We performed an abdominoperineal rectal resection, and there was no sign of an oncological rectal resection. So the arterica mesenterica inferior was perfectly intact. We didn't find anastomosis. We hardly had any scars. It was very, very difficult to estimate what they have done. I was really shocked by that, by a patient that young, having had no oncological resection. The surgeons there, they were not that surprised. They said probably the necessary stapler was missing. Maybe the consultant was out of the house and the residents were on their own. It is very, very likely that the tumor wasn't resected at all, or only in part. We don't know that exactly. Intraoperatively, we also found the liver metastasis, which we were able to resect. Jerome became a father of his first child while he was in the hospital after his surgery. After a small complication, he recovered well. But his chances of healing from the cancer are, of course, quite low. And it hit me that in Switzerland, the story would have looked different. And the resources we had in Kijabe were sufficient to treat the patient correct. So it was quite a challenge for me to accept that even if the resources were available, this patient didn't get the care he needed. Can we move to the next slide? I want to mention another point that kept me thinking a lot before, during, and after this short-term mission trip. And it is best summarized by this article, by this viewpoint from JAMA Surgery. I read it first before I came to Kijabe and was wondering if this author was right. And he said that with dedication to others, we can prevent physician burnout. We can add meaning and purpose to our professional lives and add balance to our life altogether. And I didn't really understand it. And while I was in Kijabe, I didn't understand it as well because I felt quite being on the limits there. It was working hours were similar as in Switzerland, but everything was new. And seeing so many people beyond any medical possibilities was quite hard. On our worst day, from the 12 to 16 patients we treated in our team, we lost 4 of them. We always had the feeling being one step behind. And how could that help to prevent physician burnout? And what was interesting is that I do understand this article after Kijabe very well now, and I can only confirm that it prevents physician burnout. It helps to give meaning. It helps to put their life back in perspective. And what Kijabe did with me was it made me very, very, very thankful. I saw what I had in life. I saw what we had back at home. Many problems that really bothered me in the beginning, before I went to Kijabe, they just disappeared. I just didn't see them as problems anymore. And so I had to think back to this viewpoint in JAMA Surgery quite often. And I can only confirm it really makes a big difference if you're just there for a couple of weeks. The experiences will help you personally to achieve a better balance in life. Can move on to the next slide. One back again, please. Yeah. So in summary, you can really say that short-term medical missions extend the horizon of the whole family. And here again, I really want to encourage you, take the family with you. It was amazing to have them there. It was amazing to come home and have someone to talk to. It was amazing to share this experience with the people close to me. Next slide, please. So in summary, why is it worthwhile to do short-term medical missions? It's a great learning opportunity. I learned so much from the surgeons on site in Kijabe. They were amazing African surgeons with very, very high compassion, amazing knowledge, and very good skills. It's also a good sharing opportunity. I underestimated that a little bit, but it was a great, the African surgeons were very, very interested how we did things in Switzerland. And they were interested to see how we did things differently, and they were eager to learn from my experiences. The third point, the help is really needed. I was not sure if I'm doing this trip more for myself or if I can really help there. The thing is, Africa, probably in every hospital, is understaffed. So the surgeons, they really had to work hard every day, every month, all the time. And with me being there, I was just able to take off some of the load from everyday life, from everyday business in the hospital, and they were able to finish some administrative stuff. The surgeon I was working with, she had a child that was 7 months old, and I'm not sure how often she saw it because she was always present in the hospital. And when I felt comfortable in the surgery, she was able to go home, to care for her kids, and finish some other work that piled up. The next point I've mentioned as well, it was a very, very enriching experience for my professional and personal life. It challenges you on all levels. I saw things done I've never seen before, solutions with low resources like the negative wound pressure therapy. I was also challenged in my personal life, in my faith. It was really a very, very good experience, and I still draw from the experiences made a year ago. And the thing that surprised me the most was the thankfulness I came home with. And yeah, I think that's really a great chance to see your life from a little different angle. Next slide, please. The reasons not to go on short-term medical missions are quite few. It might be time, it might be money, it might be convenience, but they're not really big obstacles to do a 2 to 4 week short-term mission trip. Something that I considered was the lack of experience. I somehow had the feeling I had to know it all before I can go into the field in Africa, and I've been proven wrong. The surgeons there were excellent. I was able to learn a lot. I was able to say, I don't feel comfortable doing the surgery, so someone else stepped in. The experience I had was sufficient, and even if I had much less or much more, it would have been fine. So lack of experience is definitely not a reason not to go on short-term medical mission trips. Next slide, please. We move from short-term medical mission to long-term medical mission now. As I said before, my dream at the age of 14 was I want to be a doctor in a country without doctors. And for 20 years, we thought about it. We even took some steps. After med school, we applied for jobs in South Africa and in Tanzania, and were turned down with the argument that we should complete our training specialty first. Nothing much happened in that time except that we were trained, not only medically, but we kind of went through a school of life, and God put us in different situations, got us together with different people, and challenged us to grow in our faith, challenged us to really get our heart with the right perspective, to care for the things that really matter in life. But it was kind of 20 years of preparation time, no specific calling. We had no real idea if we are ever needed in Africa, if we should go there, where to go. It was just a big question mark. So we waited. And we did not only wait, we tried to use this waiting time to invest in our training. And we also tried to not make any decisions that would block going to Africa. And for me, the hardest part was not buying a house. we decided to buy a smaller flat that we don't get too much in debt. And I think that was, looking backwards, it was a good step that we are free to go now. Next slide, please. With this short-term missions trip to Coma Hospital, everything changed. Suddenly, doors opened for long-term calling, and people were key in that process. Through Samaritan's Purse, we got in contact with John Tarpley, a retired surgeon who is, I'm not sure if he's currently there, but he was at that time building up a university in Botswana. And he connected us with Jens Weiland, who is currently at Coma Hospital preparing everything for the start of the Pax Program, starting in January next year. And we had a 2-hour phone call with Jens about 2 years ago. And that was eye-opening. He didn't know anything about us. We didn't know anything about him. And within 2 hours, he basically said he needs a doctor and an intensive care nurse. And he basically described our dream we had for at that time over 20 years. And that's how we decided to go there. It took us a little bit longer to make the final decision. But about a year ago, we signed up and we'll be leaving for Malawi in April next year. Next slide, please. So I didn't know much about Malawi. I don't know how it is with you. Malawi is a very poor country. It's a very beautiful country. And it's also a quite stable country, which is not to expect it from every African country in that region. So it has been politically quite stable over the last decades. Next slide, please. Can you move one slide ahead? And one more. Malawi is known to be the third poorest country in the world, with a GDP of $565 per head and year. If you compare that to the US or Switzerland, 1 Swiss franc in Malawi would equal 166 Swiss francs in Switzerland, and $1 made in Malawi would equal $123 in the United States. So there is a huge poverty problem in the country. Next slide, please. Next slide. When it comes to doctors, it's after or before Somalia, the country with the lowest density of medical doctors in the world. There are 0.36 doctors for 10,000 population. If you compare that to Switzerland, for 1 doctor in Malawi, there are 119 in Switzerland. So the difference is unbelievable. It's a hospital with 800 physicians, like the one I work in, would be run with 6 to 7 physicians in Malawi. That's impossible to imagine. Next slide, please. There's a huge lack for intensive care nurses and surgeons. There are estimated 10 intensive care nurses for 19 million people in the whole country. The reason is that intensive care units are very scarce, and they usually cared for by non-trained nurses, non-intensive care trained nurses. With surgeons is a little bit better. With 40 to 50 surgeons for 19 million people, it's imaginable that there is a huge lack of access to surgical care. And there is a quite interesting cross-sectional study that estimates that 35% of people living in Malawi have a condition requiring surgical intervention. And they estimate that 24% of all deaths in Malawi are potentially avoidable through surgery. So the need is enormous in this country. Next slide, please. Coma Hospital is more than 100-year-old missions hospital with about 250 beds, over 500 local staff. And there has been a history of training nurses and doctors, and there is quite some effort to extend that training to, especially now, the next step to surgical training. But we also hope to start an intensive care training in Coma Hospital. Next slide. So our project will mainly focus on the surgical training. By January 2022, 2 residents will start as the first Pax surgeons at Coma Hospital. The training duration is 5 years, and after every year, 2 more surgeons will join the program. So after 5 years, we will reach the maximum of 10 surgeons in training. At the same time, we need to develop an intensive care unit to allow the Pax training to happen, because major surgery is only possible with an intensive care unit. At the moment, there is none at Coma Hospital. And as I said before, we hope to start the first intensive care nurse training in Malawi in Coma Hospital. Next slide, please. Can you move back and forth again? The next slide is about the Pax program. Back, please. Back. This is one more back. One more back and one ahead. I hope it comes now. Next slide, please. Yeah, perfect. The Pax program, the Pan Academy of Christian Surgeons, I think is really key to the project. And the role of the Pax training, I think, cannot be overestimated for the development of global surgery in Africa. What makes this program so special is that surgical training is combined with a discipleship training over those 5 years. And the surgeons are not only trained for medical skills, but they're also trained to develop character, to advance in their faith. The surgeons I was able to work with in Kenya, they were compassionate, they were hardworking, they really cared for their patients. And a study published in 2019 showed that Pax surgeons stay in Africa. They migrate way less to other countries or continents than non-Pax surgeons. And the study of the first 70 graduates of the Pax program in 2017 showed that 100% of those surgeons were still working in Africa. And I think training programs like that, where we not only train medical skills, but also character, compassion, where we disciple those trainees, they're really a key to reach Africa also in medical terms, not only with the gospel. Next slide, please. I'm coming to the end, and I want to close with 2 slides that show a little bit that it's not that easy to go. And when I said with short-term mission trips, there is basically no really big reason not to go. There are plenty when it comes to long-term. First, it's scary. We have never been to Coma Hospital. We don't know what is expecting us. There are plenty of things we can't imagine how they will be like. It's scary. It feels like we're not in control anymore. A year ago, working in Switzerland, having certain career options, I had the feeling that most of my life was under control. Now I have the feeling hardly any part of my life is under control. Everything depends on so many things that I have no influence on. It's a challenge because you don't really stop your career, but you kind of give your career out of your own hands. In Switzerland, you work and you proceed in your career. In Africa, we will invest in other careers, but not our own. There's also a safety issue. The topic of how to school your kids is a challenge. And of course, money. I was really surprised how big a topic that was. The main struggle in the fight, if we should go or not, inside of me was because of my good salary in Switzerland, which will not be possible anymore in Malawi. And I would have said I'm really a devoted Christian, and my heart is really focused on God. But I didn't know how much my heart cares about money until I was trying to decide if I should go in long-term missions. So it was a very good exercise for me as well to get my heart straight again. Next slide, please. Why do we go in the end? There have been many good reasons not to go. We were really struck by the incredible need in Malawi, and with so many things in our life, we really want to give part of that back and honor God with going there. It's also a great opportunity to learn, and I'm not only talking about the medical stuff. I've learned so much over the last years, even being in Switzerland and Austria, just thinking this process through personally and in my faith, that I'm really, really excited what God will teach us in our time there. It's a huge opportunity to grow. We are not dependent on ourselves anymore, and I always knew that I'm dependent on God, but it's a whole different thing. In German, we say you jump into the cold water if you do something where you don't really know how it works out, and that's exactly what we're doing. And it's so amazing how God carries you, how God provides. It's an amazing opportunity to grow spiritually. There is great potential in Malawi, in Coma Hospital. It's an amazing job description. There are no similar job descriptions in Switzerland anymore. And I really, really look forward to the work there. And of course, it's an adventure. It's something we will experience as a family together. I'm sure it will bring our family better together. Next slide, please. I want to close up with two verses that are very, very important in the process of the last couple of years. The first is in Matthew 33. Jesus says, but seek first his kingdom and his righteousness, and all these things will be given to you as well. And that has really become a motto that I want to not invest in my own career, in my own life. I want to invest in his kingdom and his righteousness. And I think for us, the next step to do that is going to Malawi. And another verse that is very, very important for us in this phase is from Joshua 1, verse 9. Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged. For the Lord your God will be with you wherever you go. For the Lord your God will be with you wherever you go. And it's really, really cool to experience that these verses are actually true. And it takes a little leap of faith to experience it a little bit more intensive than I was used to. But I'm sure the Lord will be true to his word, and I'm very, very curious what we'll experience in the next years in Malawi. I thank you very much for listening to this talk, and I'm happy to answer any questions.
All right. Well, Dr. Widman, just want to thank you so much on behalf of Samaritan's Purse, just for you being with us today and sharing your story. It really is a miraculous story, and I'm so excited for you and Lydia and your 3 children as you embark on your long-term career there in Coma Hospital. You know, as I told you, I was just there recently, and Malawi is a beautiful country, and in Coma, one of the things that's so exciting about in Coma, to me, it's a fulfillment of like the Great Commission, but the staff there is just so multicultural. Of course, you have a lot of nationals there, some Malawian. The CEO of the hospital is from Mexico. Of course, Dr. Jens and his family, they're from Germany. There's people from the Netherlands, the United States. And so it's just an amazing diversity of people coming together, the body of Christ, to serve the people of Malawi. And it's exciting. And I hope I can return there and visit your family in the near future. So thank you so much. I have a few questions here, and just want to reach out to our audience. This is our time for questions and answers. And so if you have questions for Dr. Widman or myself, please utilize your chat box. So I'm just going to start off, Dr. Widman. Eric says, could you just describe for us the anesthesia coverage there in Coma Hospital? Who and how many provide anesthesia care for surgery?
As I said, I've never worked there in the theater. To my knowledge, the anesthesists are anesthesia nurses only. So like in most places in rural Africa, anesthesists are very, very rare. But what I've heard is that their expertise is very good and they're very reliable. Yeah.
Yeah, I was just there, and you're right. The anesthesia is predominantly like CRNAs. They were nationals, and I'm an internist, so take this with a grain of salt. But from my observation, they did a phenomenal job. We were there, and we had a week-long campaign of orthopedic procedures, and they did a very commendable job with respect to anesthesia. So, yeah. So. But you can tell us more once you go there, Dr. Widman. I'm waiting just on additional questions and everything. Please pose your questions and use the chat box. I can just make a few more comments while we're waiting on questions and answers. One, I just wanted to add a few comments to what you said. Dr. Widman, I went back in 2002 was the first time I took my family. I've shared this before. We went to Tenwick Hospital in Kenya, and the impact was tremendous. You're right. There's a lot you'll sacrifice, I think, by going long term. But you know, in reflection of work with my family, the things that we remember most are like our experiences in Kenya together. My oldest son is now in his residency as a medical physician, and my daughter is a nurse. And these are all things that were a direct impact from our family going to Kenya or going to Ecuador or going to Bolivia or all over in missions. And it had profound impact. And really, when we look back, the richness that we think about, the real rich memories are from medical missions together and serving the Lord. They didn't have anything really to do with money. So I'm not implying that it's not a sacrifice. It is, but I think God will bless you immensely for answering the call. So just a couple other things, I'll just add too, is Pax, Pan-African Academy of Christian Surgeons, Samaritan's Purse, very much supports the work that they do. And it's been tremendous. When you see, you quoted all the graduates of the program, and you're right, a lot of those graduates, they're staying. That's what the purpose of the program is really for African surgeons to train and stay right where they are. And it's been extremely successful. And I think it's really revolutionizing surgery in Africa, addressing some of those poor statistics that that you quoted during your talk. Dr. Widman, we have another question from Lee Hamilton, who works here at World Medical Mission. She said, "Thank you so much. She said, thank you, first of all, but also, did you consult with any subspecialties in preparation in going to Kajabi?
I think you have to explain that question a little bit further. So like orthopedic surgeons, or to extend my knowledge before I go there?
Yes, like exactly. Did you reach out to certain subspecialists like orthopedic surgery or maybe pediatric surgeons or anything like that?
I did not, and to be honest, there was not that much communication between Kajabi Hospital and me at that point. When I came there, they asked me what I can do, and I was very honest in that. And whenever I had the feeling I'm doing something I wouldn't feel comfortable doing in Switzerland as well, I called a consultant in. That was easily possible. We did a lot of mama surgery, which I don't do, and I think it wouldn't have made any sense to get some experience in that field before, because the way they did it there was very, very good. And with some exchange, I wouldn't have been able to add some more. And with other things like hernia surgery and things like that, it was a real vivid exchange of experiences and techniques that was very interesting and stimulating, I think, for both sides.
Okay, great.
But I didn't know much what is expecting me, and there was not that much talk with or communication with Kajabi before the short-term trip.
Okay. All right. Fantastic. We're about out of time, Dr. Widman. You're getting a lot of thank yous from our audience. We have folks from India, from Haiti, from the United Kingdom, from all over the United States, and really everywhere. So just as I say that, I just want to encourage our listening audience. Please encourage your colleagues to utilize Samaritan's Purse International Health Forum. We're really continue to want it to grow, and just utilize it as a great resource as it is for your international mission work. There's an archives full of numerous subject matters and subject matter experts, and just encourage you to utilize that archive at Samaritan's Purse. It's at health.samaritanspurse.org. Also, just a few closing comments I just want to make is if you did not receive an email recently from World Medical Mission here at Samaritan's Purse, as a effort to really encourage you to prayerfully consider going to one of our 50 mission hospitals, and just a way to say thank you, World Medical Mission is actually now covering the cost for your flights for your mission work. So I hope that will encourage you. Certainly the pandemic has really impacted travel to our mission hospitals. So they need your help more than ever. It's really dire in some situations. So we really encourage you to prayerfully consider traveling to one of our hospitals. Also, in the next edition of On Call publication here at Samaritan's Purse, really, Dr. Furman, the co-founder of World Medical Mission, really just in his editorial will encourage you to reach out to at least 2 or 3 of your colleagues. There will be an email address there to submit 2 or 3 names of colleagues that are really considering opportunities in short-term missions. Again, we just really want to fulfill the Great Commission. Medicine is such a great way to do that. And so we encourage you to do that. So again, just thank you so much for joining us today, Dr. Widman. Thank you so much. That's a great story that you shared with us. Just want to encourage you to, that CME credit is available for this session. You will receive a form and instructions in your email, and encourage you to submit that for CME. And if you haven't done so already, please join the forum, signing up at health.samaritanspurse.org, and learn about the events coming forward in Samaritan's Purse. Our next webinar will be in January in 2022, an email advertising. The topic will be coming out to you shortly. So thanks again for joining us today. You guys, Merry Christmas and God bless.